This is Bianca Martinez, and I'm going to be doing my video demonstrating how to do a dressing change. We are going to begin by knocking on the patient's door, closing their curtain, hand hygiene. We are going to introduce ourselves to the patient. Hi, my name is Bianca. I'm going to be your nurse here today, and I'm here to change the dressing. Once we have introduced ourselves, we are going to check the patient's identity to make sure we are treating the correct patient. And you have to do this by using 2 different identifiers. And I like to ask them for their name and date of birth. And if they repeat that to me, I also at that same time am looking at their medical band to make sure the information matches. Once we have identified we have the correct patient, I'm going to go ahead and do hand hygiene again. We are going to put on mask before we start the procedure. And we are also going to put on a pair of clean gloves before we start to remove the old dressing. And I'm going to go ahead and pretend that we have a clear dressing that was used before. And when you use a clear dressing, you have to change it between 5 to 7 days once it has been applied. So I'm going to go ahead and start to remove the old dressing. And you want to go very carefully to make sure you do not pull out the catheter. Once we have disposed of the old dressing into the biohazard bin, they might have some silicone tape that's also helping the catheter stay in place. You're going to have to remove that as well. Once we have taken the tape off, we're going to go ahead and dispose of these gloves. We are now going to apply on some sterile gloves because cleaning the catheter is a sterile procedure. Before I even touch the sterile gloves, you want to make sure to do hand hygiene. For opening up the gloves, the sterile. Just touching the inside of the glove. You're going to pull that down and cuffing the left glove. And now that we have our sterile gloves on, everything in the kit is sterile. So you want to pull out the alcohol stick. Having a little trouble opening it. There we go. While cleaning the site, you want to go in a back and forth motion around the whole site of where the dressing is touching. Once you have cleaned around the area, we are now going to pick up the actual catheter and make sure to clean going on the outside on the catheter line. Very carefully, you want to ensure you do not pull the catheter out again. Once we are waiting for the area to dry around the catheter, you're going to want to recoil the catheter back onto the patient's arm or where it may be. Using the silicone tape, we are going to use 2 small pieces to help stabilize the catheter even more in place to keep it from moving. And you're going to want to use it in a X manner. Sorry, these gloves are a little big on me. Once you have put the tape in set, you're going to now take out the clear dressing we are going to use. You want to make sure you put the whole dressing to ensure that it's covering the entire catheter and helping it stay in place. Now that we have removed it, I'm going to go ahead and take off the white part, but with my example that I'm using with my pad, it won't hold it completely still, but I'm verbally saying that I'm taking the white part off. And you want to initial and date, because that is going to be the day mark of when the dressing was changed. So remember, we want to keep in mind that it is changed every 5 to 7 days, unless for some reason the dressing has become wet or it's coming off prematurely. Once we have labeled the dressing, we're going to remove our sterile gloves by pinching and then getting from the inside, disposing of my garbage into the biohazard bin, hand hygiene. I am going to ask the patient if they need anything else from me, and if they don't, that is the end of my video.